when we first look at what CT can do, there's a wealth of information that's gained when we perform a CT study. And the nice thing about where CT has gone is we can actually ask it to give us either a bone window or a soft tissue window. And this is where David could add in at some point if there's questions in this area. But for me as a dentist, and what we're going to look at today, a lot of it is going to be in the bone window, where it really highlights the bone and the high detail of that. But when we look at the soft tissue window, and I've put two images side by side in the same region of the head, or close, to demonstrate what the bone window does. But when we go to the soft tissue window and we're looking at this very large sinus cyst in a young foal here, you can see that we can actually start to look at different levels of density within the soft tissue. We can see muscle planes of the tongue, the muscles of mastication, and there is definitely a nice use for this when we start to look at things that are involving the soft tissue. And here's just another one where we can actually bring out even more of the soft tissues, where we've got a cyst laying in the ventroconchal bulla, and we'll talk about those a little bit later. But you can see the well-defined region that this can give us. But on the bone window, this kind of brings out more of the sinus architecture, where with this, we wanted to look specifically at the soft tissues. So just remember that you can look at different things based on how you set up the computer to show you these images.